This last talk is very interesting. There's a study going on at Lurie Children's Hospital comparing LGS loved ones who try the next medicine versus go and have brain surgery of some kind, corpus callosotomy, DBS, RNS, resective surgery. And this was a 4-year study, I believe, and they're coming now sort of to the end of it. I think they have an extension, so it's going to be really great to get an update from Dr. Sandy Lamb at Lurie on how this study is going, because when the results are out, it will help us to know who had a better outcome. So this is one of the first comparative studies where we're testing one thing against the other, and we're very excited. So with that, roll the video, and then Fred will come up and say some final words.
I'm so excited to share with you today on behalf of our whole team. I'm Sandy Lamb. I'm a pediatric neurosurgeon and health services researcher from Chicago. So we're going to give updates about the surgery or medications for LGS, the SOM-L study, and this is powered by PCORI. Well, really the ethos of the Patient-Centered Outcomes Research Institute with their funding is to really look for teams that partner all together. The patients, advocates, families, and researchers all work together, because the idea is that those closest to the problem are closest to the solution. So really all of you, everybody in the audience and everybody living the LGS journey really is in the best position to know what we should be studying and what we should be doing better together. So your voice is essential. Here, the core team for doing this research study is actually people from all sorts of different backgrounds. So Mark Rosenman is a pediatrician who's a healthcare informatics specialist. Anu Patel is a pediatric neurologist and epileptologist with a quality and safety focus. And Tracy Dixon Salazar, who is your host here. So the study has actually been ongoing for multiple years, and this is really a big deal because this is a national study that is funded for LGS, really understanding that this is a really important topic. So I'll break it down for the multiple things that we've been doing, and the ultimate goal is really to make all of the results relevant to the LGS community, and that we share it widely all together. And we learn from you for how do we do this better, and what are the next things that we should do, and how do we make sure that everybody in the community can connect and understand and be able to use this information in a way that is helpful to you and to other families. So why and how for this study? So PCORI asked us to use national data to study Lennox-Gastaut syndrome better. And also we need to work with families directly so that we make sure that the research is relevant to those who are living through the experience. And the initial way that we set up this research was to look at a question that many families face at some point in the LGS journey, which is to add another medication for seizures or to choose a surgery for seizures. This is actually the first large-scale comparative effectiveness study looking at medical therapy versus surgical therapy for LGS. So in the way that we traditionally do research, we would look at this question and say, if you choose medicine or surgery, would we end up in the emergency room for seizures or end up hospitalized for seizures? And we can see all of those things in the medical records and in insurance records. And when we actually worked all together and worked with families from the LGS Foundation and Tracy Dixon Salazar, really the important question is how is this going to affect our loved one with LGS? And what is the impact of these treatments on communication, behavior, and quality of life? So the first thing when we look at records, we want to make sure that we're studying LGS, and I'll show you some of that work. But really, the second thing is to hear directly from families. So not only looking at the medical records, but to be able to do focus groups and surveys and really talk about things, to be able to have ways to measure these things that are typically very difficult to measure, where you know your loved one, how quality of life, or how they're able to communicate and their behavior, but how do we capture that? We're trying to do this study across multiple pediatric epilepsy centers in the United States. And some of these are from chart review, from surveys, and some are pulling data only. So what we've learned so far, because the study is still ongoing, is that when we look at this question of medicine versus surgery, it's messy, right? When we actually look in the medical records, there are all these diagnosis codes. So the first thing is we needed to be vigilant and make sure that we know that we're studying LGS because epilepsy, as you can see, is represented in multiple ways. So we worked a lot on pulling records from 7 different sites to make sure that the diagnosis of LGS is actually what we're studying. So it's really not that obvious when you look at the different features of LGS, how it's represented. So now when we're learning from all of the cases that we pulled together, and there's over 900 cases from 7 centers, we're looking at different combinations of the diagnosis codes and the medications and figuring out how to really develop a computable phenotype or, kind of a thumbprint, if you will, of LGS from medical records to be able to use it for this study and also future studies. And then when we look at how to measure behavior, communication, and quality of life, we've worked together with a lot of you in focus groups to figure out what is the best way, the most respectful way, and really the most relevant way to measure these outcomes and how to figure out if these apply to your loved ones and are they appropriate. So based on all of those, we've selected the different surveys, and these surveys were conducted over 2 years with 464 families. So many of you, and thank you for contributing. And the next thing that we're actually doing surveys on is something that Picori really wanted to help us understand more altogether. Is how do you understand indirect costs of care? So not just what insurance companies are paying, but really, what families use out of pocket and what families give up in terms of costs of like time and energy and other things, and understanding the caregiver burden for LGS families. So we know from surveys that have been done all together to look at the impact on families living with epilepsy and LGS. And we know that more than half of families experience substantial financial challenges and really express that life is like a roller coaster. And now when we look across national studies, we know that 1 in 4 families with children with epilepsy in the household report at least 1 adult in the house with foregone family employment, meaning that they've given up work hours or even quit their jobs to take care of their loved one. And we know from the Dravet Syndrome Foundation that families reported in a survey that there's about 47 missed work days per year. So when we work together with the LGS Foundation and LGS families, we've recently done focus groups to figure out how to measure this and how to have validated surveys reflect all of these unseen costs. And we've selected 3 surveys together, and we're looking for over 200 families across 7 sites to participate on these surveys now. This is incredibly important for us to understand altogether how to have the resources to be able to navigate these challenges of going through the LGS journey together and be able to take care of our loved ones with LGS. So this is the timeline for the study again. We've made a ton of progress altogether, and this is because of you contributing your incredibly valuable experiences and perspectives. And really, we need to continue to learn more how to share these results widely as we're doing the final data collection this year and doing the data analysis. And hopefully we will have official results to share next year and beyond, and continue to understand some more what to do with all of the research and really the platform and the collaboration that we've built together, because this isn't a one and done project. This is really developing a community altogether to study rare disease, LGS, epilepsy, to understand how to use national data all together in a way that continues on to help yield valuable information for questions that are really important and help us make decisions together. And really, this is for a healthier future altogether. We've done focus groups with this group in the last conference where we hear you loud and clear that priorities for future research include continuing on with this, but really understanding how families can get access to knowledgeable healthcare providers about LGS, no matter where you live and where you start your journey, having care coordination for the complexities of everything that you're going through with the LGS journey, and then transition of care across the spectrum of ages. So this is really powered by you. How do we use your perspectives to have research that is relevant and continues to help all of us and help families in the future make better decisions, be empowered with the information, and be able to make the best choices for your loved ones and your families? So to learn more and to stay up to date, here is our website, lgsresearch.org. You will find a lot of information, podcasts explaining the research, giving updates on the research, and some of the publications so far, enrolling in the opportunity for surveys and focus groups and other ways to get involved. So thank you. Please feel free to get in touch, send us your ideas, and look for our table here at this conference where you will see a lot of our study teammates so that you can learn more and really give us your ideas, and so that we can continue to do work that matters most to you. Thank you.